Hi everybody, here to show you how to do a simple fetal bedside ultrasound. To load the patient's information, click Patient in the top left corner. Click on the patient ID and load their MRN number, then just below that, enter the last name. Scroll down a little bit and enter your name in the Operator tab. We'll choose the curvilinear probe for this scan and choose the OB setting. We'll start by scanning way down low in the pelvis. Generally speaking, it's realistic to start doing these ultrasounds at about 7 weeks gestational age. Before that, it can potentially be challenging to see things properly. In these clips, you'll notice the uterus, the gestational sac, and the fetus. There's a ton of details you can learn about fetal ultrasound, but for these purposes, we're going to try and keep it simple for what you need to really know on an emergency bedside scan. Unlike performing a FAST or perhaps a gallbladder scan, the fetus can be oriented however it feels like, so sometimes you have to start in a sagittal and switch to a coronal and manipulate your probe to get your best images. The first video clip that I like to save is of active cardiac pulsations. The earlier the pregnancy, the trickier this can be. You'll notice these pulsations at the lower half of the fetal pole. Once you've found the heartbeat, the next thing to do is to measure it. Hit the M mode button on the right side of the screen and drag the green line directly over the heartbeat. Once you have it, then press the M mode button one more time. You should get a tracing that looks much like this. Sometimes I find that it looks very faint, and by turning up the gain, you'll get a much clearer image. You'll notice the cardiac pulsations at the bottom of the screen. To measure this, click on the measure button on the left side and hit the advanced measurements. The fetal heart rate should auto-select for you. You'll want to measure from the beginning of the wavelength to the end of the wavelength. You'll notice that the fetal heart rate is calculated for you in the upper right portion of the screen. I always try to remember to hit Save Image so you don't lose all this information. You might ask why we use M mode over pulse wave Doppler to measure the fetal heart rate. Both the ACEP guidelines as well as the Radiology Society guidelines suggest using M mode first because there's a theoretical risk of using pulse wave Doppler in raising the mechanical heat index of the fetus with pulse wave Doppler. It's all theoretical, but I try to follow the guidelines. I'll next measure the size of the fetus. Scan over the fetus multiple times to find the largest diameter. Click Measure on the left side and select crown rump length if the fetus is expected to be below 12 weeks and biparietal diameter if above 12 weeks. The one we're seeing on screen here is below 12 weeks. When you take your calipers and measure from one end to the other, or from the crown to the rump, it'll place your expected gestational age at the top right portion of the screen again. Here's an example of measuring a biparietal diameter. I work until I find the baby's head and measure it in an axial plane. You want to have the midline falx in view with this. This measurement should theoretically be measured from the outside of the skull all the way across to the inside of the skull. I always let the patients know that this is just a rough approximation of their gestational age, and their true dates are going to come from their measurements with their OB/GYN provider. Unfortunately, in our line of work, you may come across a fetal demise. Interpreting these types of results can be very complex and confusing. I will 100% of the time always send these patients for a radiology-based ultrasound. And in that same regard, if you're ever not confident in what you're seeing, don't hesitate to send that patient for a follow-up radiology ultrasound. Alright guys, I hope this was helpful. Thanks again.